If you've been dealing with low back pain, stiffness, or difficulty lifting your leg, there's one muscle that might be worth looking at. It's called the psoas. And the psoas is one of your major hip flexor muscles. It runs from your lower spine through the pelvis and attaches to the upper part of your thigh bone. So it plays an important role in things like walking, climbing stairs, lifting your knee, getting in and out of a car, and controlling the relationship between your hip, pelvis, and your lower back. Now, I want to be careful here. A weak psoas is not automatically the cause of back pain. Back pain can come from many different structures and movement problems. But if the psoas isn't doing its job well, other muscles might start compensating, and that can contribute to inefficient movement, fatigue, and sometimes discomfort around the hip or the lower back. So how do you know if your hip flexors might need some attention? Maybe you have difficulty lifting your knee. Maybe climbing stairs feels harder than it should. Maybe one leg feels weaker when you're marching. Or maybe you notice that your pelvis shifts or your lower back moves excessively when you try to lift your leg. One simple exercise I like is a standing march. You stand tall and you slowly lift one knee towards your chest. The goal isn't to see how high you can get it. The goal is to keep your trunk tall and your pelvis controlled while your hip does the work. You can also perform a seated march. Sit tall in a chair, lift one foot a few inches off the floor without leaning backward. Another progression is a bridge with marching. Lift into a bridge position on your back, keep your pelvis level, and slowly lift one foot at a time. Now your hip flexors are working while the rest of your trunk has to stay stable. And that's the bigger point. We don't just want a stronger psoas, we want your hips, pelvis, and trunk working together. Because improving back pain usually isn't about finding one magic muscle. It's about identifying what isn't working well and then retraining the entire movement system.